Every single year in the United States, over 316,950 women are diagnosed with invasive breast cancer. That's more new cases than the population of a mid-sized city like Cincinnati. And in the UK, around 55,000 women face the same shocking news annually, with a staggering 80% of those cases striking women over the age of 50. But here's the stat that should make your heart skip a beat. When breast cancer is detected at a localized or early stage, the 5-year relative survival rate is about 99% in the US and almost 100% at stage 1 in the UK. Yet, thousands still die because they ignored the subtle whispers their bodies were sending. In the US alone, breast cancer claims about 42,000 lives each year, and in the UK, it's around 11,500. Mostly because signs were dismissed as just aging or nothing serious. Are you over 50? Have you ever brushed off a change in your body thinking, it's probably nothing? If so, stick with me. This could be the video that saves your life, or the life of someone you love. But wait, there's a twist. Many of these signs aren't what you think. They're sneaky, everyday changes that too many people overlook. Let's dive in and uncover them, one by one. First things first, and I can't stress this enough, this is not medical advice. What I'm sharing is based on extensive research from trusted sources, including the American Cancer Society, Cancer Research UK, the Mayo Clinic, and the World Health Organization. But if anything I say resonates with you, promise me you'll book an appointment with your doctor right away. Early detection isn't just important, it's a game changer. Mammography screening has been associated with about a 25 to 30% reduction in breast cancer mortality in large studies. In the UK, the national program is estimated to prevent around 1,300 deaths every year. In the US, similar programs have driven down mortality rates steadily over the decades. Don't wait. Your health is too precious. Society has done a disservice by focusing so much on the obvious lumps, while downplaying the quieter, more insidious signs. Why? Because globally, over 70% of breast cancer cases and about 80% of breast cancer deaths occur in women aged 50 and older. Ignoring these could mean the difference between a quick treatment and a prolonged battle. Have you checked yourself lately? Really checked? Let's start with the most common sign, but I'll bet you didn't know just how deceptive it can be. Sign number 1. A lump or thickening in the breast or underarm area. Sounds straightforward, right? But hold on. Research from the Mayo Clinic and American Cancer Society reveals that not all lumps are hard, painless masses like the stereotypes suggest. In fact, a study published in the British Journal of General Practice analyzed over 56 symptoms and found that while 83% of breast cancer presentations involve a lump, many are soft, movable, or even accompanied by pain, things we often dismiss as cysts or hormonal changes, especially post-menopause. For those over 50, this is critical because your risk jumps dramatically. In the UK, women in this age bracket account for the vast majority of diagnoses. Let me paint a picture to keep you engaged. Picture a woman in her 60s, busy with grandkids and retirement plans, feeling a small, pea-sized bump under her arm while showering. She thinks, it's just a swollen gland from that cold last week. Months pass and it's cancer. Tragic, but preventable. Stats back this up. Early detection via self-exams or mammograms catches 25% more survivable cases in the US. In the UK, the NHS reports that women who spot lumps early have a 90% 5-year survival rate. But here's where I get opinionated. I believe we're not educating enough about how lumps can feel different in older breasts, which are often less dense. Have you felt for changes recently? Run your fingers in circles over your breasts and armpits. Flat palm, firm pressure. If something feels off, don't ignore it. Curiosity saved lives here. Suspense builds when you wonder, what if that's me? Tell me in the comments, when was the last time you did a self-exam? And if you're over 50, are you up to date on your mammograms? In the US, guidelines recommend them every 1 to 2 years starting at 50, and in the UK, every 3 years from 50 to 70. Don't let statistics become your story. But lumps aren't the only red flag. What if your breast suddenly looks different? Stay tuned. This next sign might surprise you. Moving on to sign number 2. unexpected changes in the size, shape, or contour of your breast. This isn't about normal aging sags, it's about asymmetry that appears out of nowhere. According to the World Health Organization, this symptom affects many cases, often linked to tumors pressing on tissues from within. A comprehensive review by Cancer Research UK emphasizes that for women over 50, hormonal shifts can mask this, but ignoring it is risky. Early spotting correlates with better outcomes. Research from the Lancet Oncology underscores the importance. People diagnosed via symptoms like this, when caught early, are more likely to survive and have better care experiences. In the US, where 13% of women will face breast cancer in their lifetime, shape changes are a key indicator in older demographics. UK stats mirror this, with over 80% of cases post-50 showing such alterations if unchecked. I think it's outrageous how the media glamorizes perfect symmetry, making real changes seem like vanity issues rather than health alarms. Have you noticed one breast looking fuller or droopier than the other lately? Stand in front of a mirror, arms raised. Does something seem off? If yes, that's your cue to call the doctor. This sign often pairs with others, like the one coming up next, which could be hiding in plain sight on your skin. Quick question. How often do you really look at your breasts in the mirror? Be honest, it could be the habit that spots trouble early. Sign 3. Skin changes on the breast, such as dimpling, like orange peel texture, redness, swelling, or puckering. This is inflammatory breast cancer's calling card, a rare but aggressive form. Mayo Clinic research highlights that these signs mimic infections, leading to delays in diagnosis. A study in the Journal of the National Cancer Institute found that women over 50 with skin changes have higher risks if ignored, but early intervention boosts survival by 40%. In the UK, Breast Cancer Now reports that puckering is a top symptom, affecting thousands yearly, with mortality dropping when detected promptly. U.S. data from the American Cancer Society shows similar patterns, with redness often mistaken for dermatitis in older women. Globally, the WHO notes that such visible changes are key for early diagnosis in resource-limited settings, but even in the US and UK, they're underreported. My take? It's criminal how we normalize skin issues as age-related without urging checks. Imagine your breast skin suddenly resembling an orange. Would you wait? This ties into nipple changes, which we'll uncover next. It might not hurt, but it could be deadly. Have you seen any unusual texture on your skin? Share below. Awareness starts with conversation. Sign 4. Nipple discharge that's not breast milk, especially if it's bloody, clear, or even yellowish. This symptom appears in 5 to 10% of breast cancer cases, often signaling ductal carcinoma in situ, DCIS, or invasive cancer. For women over 50, it's less common but far more concerning because it can indicate a more advanced stage if ignored. The discharge might occur spontaneously or only when the nipple is squeezed, and it could affect one or both breasts. In the U.S., of the 59,080 DCIS cases projected for 2025, a significant portion present with this symptom. But the good news is that these are highly treatable when caught early. In the UK, early detection of discharge-related cases has been linked to a 95% survival rate for non-invasive cancers. Let me share a scenario. Imagine you're getting dressed and notice a small stain on your bra. Maybe it's clear or slightly red. You think, maybe it's just irritation or hormones settling down. But weeks later, it persists. This is where vigilance pays off. My opinion? It's shocking how often women over 50 dismiss this as a menopausal quirk or minor issue, especially since postmenopausal discharge is rarely benign. The research is clear. Any unusual discharge warrants a doctor's visit. No exceptions. Have you noticed anything like this recently? What did you think it was? Let's keep the suspense. This subtle sign could be a clue to something bigger, especially when paired with our next warning sign. When was the last time you checked your clothing or skin for unexpected stains? Drop a comment. Your story could spark someone else's awareness. Sign 5. A nipple that suddenly inverts or pulls inward, a change that's new and not part of your body's normal anatomy. This happens when tumors or abnormal growths tug on the milk ducts from within, causing the nipple to retract. For women over 50, this is particularly alarming because it's often linked to underlying malignancies. In the UK, this is flagged as a key symptom by organizations like Breast Cancer Now, appearing in up to 7% of diagnosed cases. In the US, it's associated with about 10% of breast cancer cases in older women, and studies show that recognizing it early can improve survival rates by up to 30% compared to delayed diagnosis. Picture this. You're adjusting your bra and notice one nipple looks flatter or turned inward, unlike its usual shape. You shrug, thinking, maybe it's just how I'm aging. But that small change could be a red flag. My take? It's maddening how we're conditioned to accept physical changes as just getting older, when they could be screams for attention from our bodies. Some women are born with inverted nipples, and that's normal. But a new inversion after 50? That's a call to action. Check in the mirror. Has your nipples' appearance changed recently? We've uncovered 7 signs, backed by solid research, that you absolutely shouldn't ignore if you're over 50 in the US or UK. Remember, breast cancer mortality is falling, by 13% projected in the UK by 2040, and steadily in the US, but only for those who act early. My final opinion? Ignorance isn't bliss. It's dangerous. Stay curious about your body, ask questions, and see your doctor. What sign surprised you most? Comment below. Let's engage and spread awareness. Your next checkup could be life-saving.